Welcome to Rescue Health. Subscribe for more videos like this one.
8 symptoms of heart failure. Heart failure, sometimes known as congestive heart failure, occurs when the heart muscle doesn't pump blood as well as it should. When this happens, blood often backs up and fluid can build up in the lungs, causing shortness of breath. Certain heart conditions, such as narrowed arteries in the heart, coronary artery disease, or high blood pressure, gradually leave the heart too weak or stiff to fill and pump blood properly. Today we are going to discuss the 8 symptoms of heart failure. Number 1. Sudden unexplained weight gain. Weight gain may be the first noticeable sign that you have developed heart failure or that your heart failure is getting worse. The amount of weight gained varies greatly among people with heart failure, and it reflects the amount of sodium and water the body has retained. Weight gain alone is not an indication of heart failure, but this sudden and unexplained weight gain combined with other symptoms might be a sign to go speak with a primary care doctor or cardiologist. Number 2. Swelling in ankles or feet. People with heart failure often experience swelling in their ankles or feet. You might notice that. The degree of swelling you experience depends on how well your body is compensating for heart failure and how much sodium and water your body retains. The medical term for this swelling in the legs is pedal edema. Pedal refers to the feet and edema refers to the buildup of excess fluid. Heart failure often causes what doctors call pitting edema, meaning that applying pressure to the swollen skin leaves an indentation in the skin. Doctors often test for edema by pressing their thumb to the skin and seeing whether it leaves an impression. You may see this yourself if you take off your shoes and socks and find that your socks have left an impression in the skin of your ankles and feet. Number 3. General shortness of breath. While shortness of breath is the most common symptom of heart failure, it may be difficult or impossible to distinguish it from shortness of breath caused by other health problems such as emphysema or severe anemia. Your doctor can help you determine why you have been feeling short of breath. People with heart failure experience shortness of breath in many different ways. You might feel that. You can't catch your breath. You feel tightness in your chest. You feel tired when you walk. You need to stop a lot when you walk. It gets worse when you lie flat, and it may wake you up at night. Number 4. Exercise intolerance. If your shortness of breath isn't severe, you may notice it only when you are exerting yourself, and sometimes only during more intense exertion. The medical term for this symptom is dyspnea, say dyspnea. When heart failure develops gradually, your shortness of breath also may develop gradually, which can make it hard to notice. But people with more severe heart failure may have shortness of breath with minimal exertion. Number 5. Shortness of breath while lying down. People with more severe heart failure may experience shortness of breath when they lie down. The medical term for this symptom is orthopnea. The severity of this symptom usually depends on how flat you are lying. The flatter you lie, the more you feel short of breath. To gauge the severity of this symptom, doctors often ask people how many pillows they need to lie on to avoid feeling short of breath in bed. For example, 3-pillow orthopnea is worse than 2-pillow orthopnea because you have less tolerance for lying flat. Number 6. Discomfort while sleeping. Some people with heart failure wake up in the middle of the night with severe shortness of breath. The medical term for this symptom is paroxysmal nocturnal dyspnea, PND. This may occur with waking up coughing or wheezing, having a rapid heart rate, and a feeling of being suffocated. In general, people who experience PND don't feel increased shortness of breath when they first lie down. But after several hours of lying down, they awake with shortness of breath, which often occurs suddenly. The shortness of breath generally goes away after a few minutes of sitting up. Number 7. Extreme fatigue and weakness. If you are feeling a sense of overwhelming tiredness or lack of energy to the point where daily life is affected by it, it may be a sign of an underlying medical condition or heart failure. Such is the case with heart failure and fatigue. With heart failure, your heart does not work as efficiently as expected, which decreases the amount of blood it pumps and funnels throughout the body. Your heart chambers respond by stretching to hold more blood, which is a temporary solution to keeping blood moving, but this also weakens your heart's muscles, further weakening its ability to pump blood efficiently. Number 8. High blood pressure or hypertension. Hypertension is a major risk factor for heart failure. That's because the force pushing on the walls of your arteries as blood moves through them is too strong. That pressure hurts your arteries and makes tiny tears in them that can turn into scar tissue, which makes it easier for cholesterol, fat, and other things to build up. That causes your vessels to narrow and stiffen. Over time, these things make it harder for blood to flow through your vessels. That forces your heart to work harder than usual. Use discernment with this information. If you are worried about your health, please talk with your primary care doctor or cardiologist about your concerns.
I hope you liked our video. Please give it a big thumbs up and subscribe to our channel. And make sure to hit the bell icon. It helps the YouTube algorithm bring our videos to the top. We'll see you in the next one.